Hi, my name is Allison Jones. I'm a senior athletic training student at Florida Gulf Coast University, and I'm going to be performing the SCAT 5 assessment tool to conduct a concussion exam. So to begin, I'm going to have my immediate or on-field assessment, and with this, I'm going to be looking for red flags. This would include neck pain or tenderness, double vision, any weakness or tingling and burning in the arms or legs, a severe and increased headache, a seizure or convulsion, any loss of consciousness, deteriorating conscious state, any vomiting, and increased restlessness or agitative combativeness. So clearly my athlete does not have either of these symptoms. And with this, I'm also going to have observable signs. So with the mechanism of injury, are they laying motionless on the surface? Do they have any balance, gait, or coordination? Are they stumbling when they're trying to get off the field? Do they give me a blank or vacant look? Are they disoriented or confused? Do they know where they are? Can they respond appropriately? And if there's any facial injuries after a trauma. Next, I'm going to have some MATIC questions. So I'm just going to see if they're able to cognitively answer me. So I'm going to ask you a few of these questions. Can you please listen carefully and give your best effort and tell me what happened? So this is when they would tell me if they got hit on the field or whatnot. Then I would continue to ask what venue we were at today, what half it is now, who scored in this match or game, and what team did they play last week, or what team are they currently playing in the game, and did their team lose or win at their last game. Next, I'll be doing the Glasgow-Coma scale. This is an examination assessment to test their eye response, verbal, and motor responses. So I'm going to make sure that they can have eye opening. If I see and their eyes are open, that's going to be a score of 4. Verbal responses, if they're able to comprehensively respond to me, that's also going to be a score of 5. A best motor response, if they're easily able to respond to pain and they're obeying all commands, that's going to be a 6. Next, I go into a cervical spine assessment. I'm going to make sure that the patient is pain-free in the neck, and if so, I'm going to make sure that they can have a full range of motion. So if you could just bring your chin to chest, and then chin up to the sky, and then ear to shoulder on both sides for me. Any pain with that? No. And then I'm also going to do some manual muscle testing to just make sure that they have normal length strength throughout. Next, I'm going to move into our all-field assessment. So this can be done in the athletic training room or on the sideline, just away from the busyness. I'm going to ask the athlete about some background information, what sport, team, or school they're a part of, the date or time of the injury. I'm going to ask what grade they are in, how many educational years they've completed, their age, their gender, their dominant side, and if they've had any previous diagnosed concussions in the past. This is a crucial question to ask just to watch out for the second concussion syndrome. If they have, I'd want to know what was the most recent concussion and how long was the recovery time. I'd also want to ask if the athlete has ever been hospitalized for a head injury, diagnosed or treated for a headache disorder or migraines, and if they have any learning disabilities like dyslexia. They could also let me know if they've been diagnosed with ADD or ADHD, or depression, anxiety, or any other psychiatric disorder. I'd also want to know what medications they're currently on and have them list them for me. Next, I'm going to have a symptom evaluation. So I'm going to hand the patient a symptom evaluation checklist, and I'm also going to ask them to read aloud a paragraph of directions and just be able to monitor and see how their speech is. So I'm going to give this to you. You're going to rate from 0 to 6 on each of these symptoms here listed here, 0 being none and 6 being severe. So if you could please read this for me.
The athlete should be given the symptom form and asked to read the instruction paragraph out loud to complete the symptom scale. For the baseline assessment, the athlete should rate his or her symptoms based on how he or she physically feels, and for the post-injury assessment, the athlete should rate the symptoms at this point in time.
And then I would also have the athlete fill out this and rate and keep this for my records. At the end, I would total up the list of the number of symptoms out of 22, and that way I could get a severity to compare later on when I reassess these symptoms. The next step I'm going to do is a cognitive screening. So I'm going to ask my patient, do you know what month it is?
May.
Do you know what day it is today?
The 30th.
Do you know what day of the week?
Roughly, Thursday.
Okay. Do you know what time it is?
6:30,
And the year?
2019.
Great. So that is a score out of 5. They answered all 5 questions correct. The next thing I'm going to do is test immediate memory. This is going to consist of a 5-word list, and each of these lists that I'm going to read, I'm going to do 3 complete trials. So I'm going to have you repeat these words to me. I'm going to read them to you aloud, and you can repeat them in any order you'd like, and I'm going to do it 3 times. So I'm going to give you dollar, honey, mirror, saddle, anchor.
Dollar, honey, mirror, anchor, saddle.
Yep. Next, I'm going to ask you to repeat these words again. I'm going to repeat them to you, and you repeat them back to me. Any order. Dollar, honey, mirror, saddle, anchor.
Dollar, honey, mirror, saddle, anchor.
Yes. And then last time for the 3rd trial. Dollar, honey, mirror, saddle, anchor.
Dollar, honey, mirror, saddle, anchor.
Great. Alternatively, if I wanted to, I could use a 10-word list. This is a little more advanced. The 5-word list was just 5. Next, I'm going to have to test your concentration. So I'm going to be reading out some numbers, and you're going to repeat them back to me backwards. So for example, if I say 1, 2, 3, you would tell me 3, 2, 1. So I'm going to say 4, 9, 3.
3, 9, 4.
6, 2, 9.
9, 2, 6.
And now I'm going to move on and add another number. 3, 8, 1, 4.
1, 4, 3, 8.
Close. 3, 2, 7, 9.
7, 9, 3, 2.
So she couldn't do the 4 numbers right, so I would stop at that instead of continuing on to the 5 digits. Getting these correct, each is a point. They'd have to get both of the rounds correct to receive their point. So now I'm going to have you repeat the months in reverse order to me. So you would start with December and then go to November and continue on.
December, November, October, September, August, July, June, May, April, March, February, January.
Yep, that's great. So that's also another point because she was able to do that. Before I go on to my neurological screening, I'm going to make sure that you can recall those words that I gave you before. Do you remember those 4 words? 5 words.
Anchor,
5 words.
saddle, dollar, penny? I don't know.
Do you remember any other ones? It's honey and mirror.
Honey and mirror.
So she would receive 1 point for each correct. So for that, she got 3 correct and 2 she couldn't remember. So that's 3 points right there. Next, I'm going to go into my neurological screening. I'm going to have the patient read aloud, which she already did with her symptom checklist. So I could give that a yes. Did she have a full range of motion passively for cervical spine movement? Yes. And would she be able to move her head and neck side to side and look up and down without double vision? So this is something I'm going to test. So I'm going to have you follow my finger, and without moving your head, you're going to follow your eyes. So I'm going to 3 times. So with this, I'm looking for any nostalgia, any like dilation, and just make sure that her pupils are equal throughout. So with that, that would be yes. And then I'm gonna see if she can perform a normal gait. So if I could just have you stand up and just walk there and back to me. So with her gait, I'm looking to see if there's any misbalance, so she has to hold on to the wall, she's stumbling. So she did not, so I would say that she could do that. So next I'm gonna have you actually stand up and I'm gonna do a balance examination. So I'm gonna do the best test. Things I'm gonna looking for is I'm gonna grade her on errors with her balance. So first I'm gonna have you open your with your eyes open. I'm gonna test your balance by having you take off your shoes, please. I'm already able to see her ankles, so that's great. And then this test is gonna consist of 3 20-second tests of different stances. The first one is the double leg stance. So I'm gonna have you stand with your feet together and your hands on your hips with your eyes closed. You're gonna maintain this stability. You can keep them open until I'm done. You're gonna maintain this stability in this position for 20 seconds. I'll count the number of times. You move out of this position and I'll start timing as soon as you have your eyes closed. So whenever you're ready. Great, you can stop. So I was looking as she lifted her hands off her chest, she either opened her eyes, any stepping or stumbling, if she moved her hips and abducted them, if she lifted her forefoot or heel off of the ground, and if she was remaining out of that position for greater than 5 seconds. She did not, so she would keep full points for that test. The next is going to be the single leg stance. So if I had you kick a soccer ball, what leg would you kick with?
My right.
Right? So this is going to be her dominant, and now I'm going to have you stand on your non-dominant foot, so your left foot for me. And your right leg is going to be in a 30 degrees of hip flexion and 45 degrees in knee flexion. So I'm going to have you maintain the stability for 20 seconds with your hands on your hips, again, that same position. And if you stumble or open your eyes, just please return to this position and try and hold it for the 20 seconds. So I'll continue as soon as you get in that position and close your eyes. Hip flex a little bit more. There you go. So I would give her 3 points on that. She had her hip abduct twice and she opened her eyes once. So 3 total errors. The last best balance test I'm going to perform is the tandem stance. So I'm going to have you stand heel to toe, and with your dominant foot is going to be behind you. And this should be held for 20 seconds again, with your hands on your hips and your eyes closed. So I'm going to count the number of times again that you move out of this position, and if you have to move, please return to this position right away. Okay?
Okay.
Okay. So she moved out of position about 2 times, so that would be 2 points. And that would be, I total up all the points, so she had 3 with the single leg stance and 2 on the tandem stance, with a total of 5 points out of 10. After the balance test, I'm going to do a tandem gait examination for you. So I'm going to have you do a gait with heel to toe, and you're going to follow along this line in the carpet, and try not to lift your hands or get off balance. With this, I'm looking to see if she has any gapping between her heel and her toe, if she's falling off balance, and needing to lean onto me for support. The next I'm going to have you do is for coordination. You're going to sit comfortably on the chair for me. Your eyes are going to be open, and your arms are going to be outstretched like this. You're going to flex your elbow 90 degrees to bring it to your nose. I'm going to have you repeat this 5 times with each finger, so a total of 10 repetitions. Do this as fast as you can for me. Okay, so I'm just making sure to see if she has, how accurate she is with bringing her finger to her nose and how quick her speed is. Finally, after this, I'm gonna view my decision. With this, I total up all the points that I've conducted throughout the SCAT 5 assessment, and out of the total scores, I total them up to get an objective measure. With this, it is very clinician based and it is on my judgment. So with this, you wanna make sure that you don't use this as a standalone method to diagnose a concussion. Every concussion could be represented differently among individuals, and symptoms could be delayed or earlier and resolved quicker depending on each person. With this, I'd wanna make sure I'd also use other tests just to aid my decision, such as the impact testing or even BOMs.